Hi everyone, welcome back to my YouTube channel. On today's Face Facts by Dr. Yusra, we are talking all things noses. My name is Dr. Yusra Al-Mukhtar. My background is in dental surgery and I worked in oral and maxillofacial surgery for several years before embarking on my career in aesthetic medicine. I now have 3 clinics, one in London, one in Liverpool, and one in Manchester where we are filming today. And we specialize in a range of different aesthetic medical procedures, including endolift, laser skin resurfacing, body contouring, weight loss, fat loss, skin rejuvenation, and we also have dental surgeons who perform dental treatments and restorative aesthetic dentistry in our Liverpool clinic. One of the most commonly requested procedures in my clinic is the non-surgical rhinoplasty. Over the last decade, I have treated thousands and thousands of patients for non-surgical rhinoplasty. And this is a non-surgical procedure that is used to align or lift the nose. Now, why would you consider having a non-surgical rhinoplasty, and who is this treatment for or ideal for? This is a treatment that involves changing the shape of the nose without performing surgery. And it is ideal for those people who might have a small dorsal hump on the nose, they might have a deviation from the center, they might have indentations that mean that their nose is not catching the light in a symmetrical manner and they have shadows on their nose. They might have a downwards rounded or droopy tip. And also when they're smiling, they might find that their nose pulls down. It's a great procedure for those who want to create minor and sometimes significant changes in the appearance of their nose. Now, this is a concern for millions of people worldwide. In fact, data shows that 26% of British people have considered having some form of intervention to the appearance of their nose. And what I find with this procedure is that when people are coming in requesting non-surgical rhinoplasty, they often say to me, I hate my nose. And hate is such a strong word, but it comes with a huge psychological burden, an impact that it has on their self-esteem, on how they show up every day, on their confidence, their self-worth. And it really truly is a burden for many people. So much so that I've heard people say that they won't go on first dates, they won't get in front of a camera, they won't sit next to people at dinner, they'll always sit opposite someone because they don't want them to see the side view of their nose. And we know that those people who feel that they do have a protruding nose or a deviation on their nose or a dorsal hump deformity, or even a downward drooping tip when they smile, avoid smiling. So it impacts their quality of life on a daily basis. And it might be these little micro moments that impact them, but this is real and it's significant for so many people. So treating it, in my opinion, is not just putting a mask on someone, but actually allowing them to take their mask off and walking into their life without feeling burdened by their appearance. And certainly it's one of the reasons why we trademarked our empowering transformations, because this is what we do. We create empowering transformations on the inside out. We give people back their confidence. And when I teach, I often say we inject confidence. And I don't say that lightly. I actually really truly mean it. I've had people cry in my surgery as soon as they've seen the appearance of their nose afterwards. The burden that it lifts is huge. And when I see my patients back a year or even 2 years later, they often say to me, I just don't think about it anymore. It's something that I used to think about every single day, and now I just live with confidence and it's not holding me back. So it's not always just about the aesthetic outcome, but actually the confidence that it brings with it. And that's something that I'm really passionate about. And I will never dismiss, because I have seen firsthand how much this can impact someone. If you've had surgery, can you have a non-surgical rhinoplasty? The answer is yes. About 30% of the patients that I see in clinic are those who have had surgical rhinoplasties that have unfortunately go wrong. And now with vulnerability, I'm going to share with you that I truly understand that, because when I was working in maxillofacial surgery, I was working in a department that was focused on rhinoplasties and with a surgeon who was focusing on rhinoplasties. And during that time, I realized that I had a deviated internal septum and I couldn't breathe on one side of my nose. And I had a conversation with my consultant at the time who told me that he could fix it surgically. But unfortunately, I ended up with a complication called a perforated septum. That meant that I was whistling through my nostril. And I had the first surgery Christmas Eve, and was left over the Christmas and New Year period with a perforated septum and literally whistling with every breath. And then in the new year, went back to my surgeon who realized I had a perforated septum and told me I had to have a second surgery to repair it with a graft. And it was a really, really traumatic time. I had 2 surgeries 4 weeks apart. They were not rhinoplasties. They were not intended to change the shape of my nose. But because of the complication, I had to have what we call a spreader graft, a graft to spread the nostrils wide so that I could breathe and to align the septum. And I woke up and I was mortified at the appearance of my nose. It really impacted my self-esteem, it impacted my confidence. I didn't want to take photos anymore. I didn't want to be in family photos. And that was the start of my passion when it came to noses and my obsession almost, because I really, really understood what it means for people. Now, if you've had surgical intervention and you've been left with a complication and you want to correct it, then you do have 2 options. You can go down a surgical repair pathway, or you can consider a non-surgical rhinoplasty. But let's not sugarcoat the fact that if you are having a non-surgical rhinoplasty after having had surgical intervention, there is a higher risk of complications. Now, with every non-surgical procedure where we are treating an area with dermal filler, what we are doing with a non-surgical rhinoplasty is we are augmenting the nose, or we are placing micro-droplets of dermal filler in a very strategic, very precise way to change the shape of the nose. Now, the technique that I've developed, I call it the ALR technique. This stands for Align, Lift, Refine. And the idea is that for those patients who have a bump on their nose, we can align the nose. For those who have a droopy tip or want to lift the tip or want to improve the light definition at the tip, if they've got a wide or rounded nose, we can define and lift the tip. And for those who just want minor refinements or all 3 alignments, lifting and refinements, we can do that. So the idea behind the performance of a non-surgical rhinoplasty is using the right dermal filler that is designed to emulate bone, that can be injected in micro-droplets along the bridge of the nose to straighten a nose, to improve asymmetry, to improve light reflection, and where appropriate to lift the nasal tip if a patient wants that. But really, this is such a personalized treatment. There is no one size fits all. There's no one shape for all people. You don't have to have a pixie tip lift. You don't have to have a straight nose. It's absolutely fine to have a bump on your nose. This can be tailored to your desired outcome. And that's what I call a holistic, individualized treatment. We don't create cookie cutters or clones of people. We want you to look like you, just the best version of you. And if there is something that is bothering you, whether it's a bump or deviation or lack of light reflection or lack of symmetry, then we can tailor the treatment according to what you want to achieve. Now, which fillers do we use? There are a range of different fillers in the market, but the most important one when it comes to non-surgical rhinoplasty is that we're using a filler that is designed for precision, definition, but not volumization, because when you are augmenting the nose, the last thing that you want to do is make it bigger. So it's a very, very artistic, very precise, very calculated treatment that has got to be done with a delicate, steady hand, with a knowledge and respect for the anatomy, and with care. And most importantly, less is more. You don't need large volumes to straighten the nose. You need a filler that's going to give you lift and precision without widening the nose. And not all fillers respond in the same way. So the fillers that I use are specifically designed and FDA approved for the nose. You can use products in the nose that are off-label, which means they don't have FDA approval or are not on label for the use of non-surgical rhinoplasty. Again, it's not one size fits all. Our patients come in different sizes, shapes, colors, their skin is different thickness, so we use the right filler for the right patients. Let's talk about complications when it comes to non-surgical rhinoplasty. Now, any area that you have injected with dermal filler, there is a risk of complications. And the usual things are risk of bruising, risk of swelling, and those are things that we generally don't worry about because they're transient and they go away. But what about complications where things can go wrong? Well, of course, these are risks and complications can happen, but thankfully they are very, very rare. And clinical research, and certainly in my clinics, we found that the risk of complications is less than 0.1%. It is very, 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 very rare to have a complication. Now, what complications do we worry about? We worry about things that can cause permanent damage to a patient. What can cause permanent damage? Well, if a filler goes into a blood vessel and that blood vessel connects to the eye, then the patient can lose their vision temporarily or permanently. Now, whilst thankfully this has never happened in my clinic before, it's something that I'm really cognizant of and always do my best to reduce the risk for my patients. How do we reduce the risk for our patients? We use micro-droplets of filler, tiny, tiny increments, tiny, tiny volumes injected on the deepest plane of the nose. That is the safest area of the nose to inject. Now, nobody can guarantee it's 100% safe, so we've got to approach that with care and respect. The other way that we increase safety profile for our patients is we can use an ultrasound device. An ultrasound device allows us to see where the blood vessels are in the nose and navigate around them. And that's what's called vascular mapping. That means we assess where your blood vessels are and we choose to place our filler according to where those blood vessels are to avoid any filler going into a blood vessel. Now, all of these techniques, including using small volumes and ultrasound, injecting deep on the deepest plane of the face, is not a guarantee of a safe outcome, but they increase the safety profile of the treatment. And of course, your injector and your injector's expertise is very important. This is not an area that I personally dabble in. It's an area that I do on a daily basis and have done for almost a decade now. It's an area that I'm obsessed and passionate about because I understand how much of a difference it can make. And so I've studied in great depth and performed thousands of procedures. And I think it's really important that if you are having a procedure that is particularly complex, like the nose, that you make the right choice for you and choose a practitioner that is in alignment with you, has the same vision as you, the same ethos, and will do their best to keep you safe and has the experience and expertise to do so. Now, when it comes to the nose, the reason why we say that this is one of the highest risk areas of the face to inject is because the vessels that supply the external aspect of the nose communicates directly with the eye. So if filler goes into one of those blood vessels, then it can cause visual issue. That's why we say approach with extra care. And that's why I always advise my patients to be really, really mindful about where they're going for this particular procedure. And there are some incredible practitioners out there. So just make sure that you're doing your research and you're choosing the right clinician for you. The other thing to be mindful of is that there's a risk of what we call vascular occlusion and necrosis. What does that mean? That means if the filler goes into a blood vessel and blocks the blood supply to the skin, then the skin can die. Now, it's not like an instant death, and there are signs and symptoms that something is going wrong well before things do start to go wrong. And that includes the nose going different colors, so it might go very, very red, or it might go very, very white or pale. It might feel cold. It might be extremely painful. That's definitely outside of the norm. This procedure is not particularly painful and should not give you significant amounts of pain afterwards. It usually takes minutes to do. Patients go back to their daily life immediately with no real downtime. But if you experience excruciating pain, difficulty sleeping, pain in your teeth, any white possible spots on the nose, any spreading rashes, extreme redness or paleness on the nose, then you need to get in touch with your practitioner. And the treatment of choice is dissolving the filler. If the filler is sitting in a vessel or next to a vessel and blocking the blood supply to the skin, then the skin doesn't have the nutrition that it needs to survive, and then it will undergo necrosis or skin death. It takes time for necrosis to set in, and that's why we say you've got to stay in touch with your injector. You need to know the signs and symptoms to look out for, because if treated promptly, there is no reason why you should have a necrosis. Now, if you've had a surgical rhinoplasty in the past and you have had a complication, or you're unhappy with your results after surgery, or you've been left with contraction or indentation, which we often commonly see, you can have a non-surgical rhinoplasty to correct it, which is often a really easy treatment to have, again, in the right hands. If you've had surgical rhinoplasty in the past, you are at a higher risk of complications because underneath the area, the skin, you tend to have fibrosis or scar tissue. And scar tissue means that that's a scarring that happens internally after a surgical cut can pull the vessels down and they can sit in a different place. And it means that when your injector is putting filler in, there is a tighter space for that filler to flow in. Accordingly, please make sure that you are going to someone who has experience and expertise in treating post-surgical complications with rhinoplasty. And in my clinic, I do not perform non-surgical rhinoplasties for patients after surgical intervention without an ultrasound. Ideally, you should be having an ultrasound to assess where the vessels are so that your clinician is mapping out the vessels, and then when they are injecting, avoiding the vessels to keep you safe. So how long does this treatment last? Most patients will get anywhere between 12 to 24 months out of this treatment, depending on what filler is used. I like to use longer lasting fillers that give my patients the gift of time, and it really is an area that holds on to filler quite well. But of course, there's going to be variation. No two people are the same. Some people break down filler much faster than others. Some people keep filler for longer. And we don't know who that is, but certainly I've seen patients who several years on still don't need a top up. Now, in my clinic, if you've had a non-surgical rhinoplasty with us, we offer a totally free of charge top-up at the 4-week mark for those who need it. And that's because many patients do find that the nose can relapse a little bit. And so if that happens after 4 weeks, after the swelling goes down, we bring you back in and we offer a complimentary free of charge top-up, which is included in your initial payments. If the patient needs a top-up 6 months down the line, we give them 50% off. And then when they come back a year or more down the line, we give them 10% off. And what I find in my clinic is that my patients find that this treatment really does last quite a long time. They might come back after 12 to 18 months for a top-up. After the second time they've had the treatment, it tends to last several years. And each time they have the treatment, it lasts longer and longer. Now, sometimes if you've had repeat treatments back to back after a few years, what you can find is that the filler can start to spread a little bit in the local area. So what doesn't happen is that filler doesn't grow legs and walk around your face. That is not what happens when we talk about migration. What can happen is you can get a little bit of spreading of the filler in the area that's been injected. And if that happens, it is not a big deal. It can easily be reversed or dissolved and then retreated. So I often say to my patients, look, we will do this procedure for you if they're appropriate for it after having an assessment, and explain to them that after having 2-3 treatments, if they start to notice that the filler is slightly moving or they're getting a little bit of swelling or a little bit of widening, particularly at the bridge of the nose, then after 3 to 5 years, we might decide to take it all out, dissolve it, wait a week, and then retreat it. And it's a pretty straightforward procedure to have done. Why do I love the non-surgical rhinoplasty? Well, because it is such a transformative procedure. It is so life-changing for so many people. It gives them massive amounts of confidence and really does allow people to just crack on with their lives, live their lives fully without feeling held back, not being conscious about their hairstyle or where they're sitting at dinner, and just show up in their daily lives feeling awesome. And that is why we turn up to work every single day. So I hope you've learned a lot about the non-surgical rhinoplasty. If you have any inquiries, you want to have a consultation, then please do get in touch. You can contact us via the website www.docsyusra.com. You can give us a call. You can send us a DM on Instagram. If you want to look at some of our before and afters, some of my before and afters, you can go on Dr. Yusra Rhino on my Instagram page. I have an Instagram page dedicated to noses. You'll see a range of different shapes, sizes, colors of noses. We treat them all. If you want to come and see me when you're not sure if the non-surgical rhinoplasty is for you, just book a consultation. We can assess you, advise if it's appropriate, or if alternatively surgery is the best option for you. Remember, it's not one size fits all. The whole idea of personalized aesthetic medicine is that you find someone who will create the clinical outcome that you want. Thank you for watching, and I will see you again next time. Don't forget to like, subscribe, and comment below. Bye.